levothyroxine, I'd be struggling to justify it on any level of medical evidence. And that's been proven in Europe and American thyroid communities as well. The actual evidence is very difficult to find.
Okay. Stay with us if you can. Dr. Amanda Doyle joins us. Amanda, I wouldn't have your job in a million years. She's from the NHS Clinical Commissioning, which had drew up the list we heard about last week of stuff that maybe shouldn't be prescribed or won't be prescribed. Now, where are you on this? I understand you're not an endo expert, but what's your understanding of it?
So, no, I'm not an endocrinologist, but I am a GP. So I have a relatively high amount of experience of treating thyroid patients. Our approach is that there is no clear evidence of benefit, as you've just heard described in some detail, of liothryonine over and above levothyroxine for the vast majority of patients. And what we're saying is where there's no clear evidence of clinical benefit over and above cheaper alternatives, then we would recommend the alternatives. And we spend upwards of £30 million a year on liothryonine with no clear evidence for most of those patients of a benefit over the cheaper version. We're not proposing a blanket ban on some of these medications. What we're saying is that in most cases, patients can be treated equally effectively with a much cheaper drug.
Okay.
There will always be exceptions.
Can you may not know the answer to this, but I can't understand why it's costing so much money for the NHS to get it when you can buy it for buttons elsewhere in Europe. Is there a simple reason for that? Sure, the NHS can surely buy drugs from wherever it wants to buy them.
There's a complex process whereby drugs are priced, they're given a national tariff. It's not uncommon for prices, over-the-counter prices in different parts of the world to be either cheaper or more expensive than the drug tariff for the NHS.
Okay, but look, it's different, but it goes from very expensive to next to nothing. I mean, that's a huge disparity. Now, if that's just the way it's got to be for whatever reason, that's the way it's got to be. But in the end, you can't police this, because if you can get these drugs on the internet, which you'll be able to for nothing, nobody's going to be able to stop that.
No, absolutely not. The difficulty is that it's much safer for patients not to buy these drugs without prescription. There are, you can get harm from taking these drugs if it's not carefully monitored. As we heard before, there's lots of other conditions that can produce similar symptoms, so patients treating themselves is not safe. But we can't do anything to stop people going buying medication. What we're trying to do is get the best healthcare we can out of the limited NHS resources. So this is...
Okay. So as a GP, what do you do with somebody like Melanie? And I'm not asking you to comment on her case, but there will be people, a small amount, 1 in 10 or so, will come back for whom the levothyroxine doesn't work, or their life's still misery. What do you do with them then? I mean, why not just refer them to an endocrinologist?
So, as a GP, if a patient isn't getting benefit from the treatment I've tried for an endocrine condition, then I would refer them to an endocrinologist. I think the difficulty is that a lot of the symptoms of thyroid disease are vague and can be equally attributed to lots of other conditions. So sometimes this is difficult to identify what the specific problem is. If somebody has normal blood tests and a range of symptoms that could be attributed to lots of other conditions, then it's not always easy to identify how to resolve the problem. But there's no attempt to stop people being referred to specialists, and there's no attempt to put a blanket ban in place where small numbers of patients can benefit from these medications.
Well, I've just got a text in which kind of describes the situation. At last, national coverage on T3. After 2 years being so ill, I was housebound, not functioning. After my own research, and look, we're going to end up in trouble if people end up doing their own research on the internet. But here, I asked 3 doctors for T3. I got my life back within a few weeks. I could stand up, walk, hold a conversation, drive again. My GP isn't allowed to describe it now due to cost. NHS is charged £250 a box by a company which has a monopoly. I'd buy online from Greece, €1 a box. If the NHS sorted out the monopoly, we could access this vital drug cheaply. Now look, you're a medic, you're not a businesswoman, but plainly something needs to change here, doesn't it, with the purchasing?
So that there is an issue with the cost of medication, and that's what the problem is. But if you buy medication online, you actually don't absolutely know what you're getting. You don't know that the dose is accurate. You're unable to monitor it. We would never advise patients to self-medicate with medication bought online. There's risk.
But if the decision is that or nothing, what are you going to do if your life's misery with this condition? You know, it's. I'm not blaming you. It's just an impossible situation.
It's a really difficult situation for patients, but we're not talking about banning this medication.
No, I understand.
For people where a low T3 level causes severe symptoms and a miserable life. What we're saying is that for the vast majority of patients, it's not 10 to 15%, the evidence shows it's a much lower number of patients that actually need an alternative to levothyroxine. So for the vast majority, we're saying use the cheapest effective alternative.
Okay, thank you all very much. Doctors Doyle and Vanderpump and Melanie as well. And I hope you stay well.
Thank you.
Thanks very much for your time. Just before the top of the hour, let's move on to a story which incredibly is even more complicated than the last one. It's to do with graphene. Professor Rahul Nair is from Manchester University. Right, remind us what graphene is. I know it's something extremely clever and very promising, and then what good has happened to do with it?
So graphene is the thinnest material, so it's made up of carbon.